Hello again, everybody. Welcome to Orange City Area Health System's COVID-19 Community Briefing, 10th edition. My name is Marty Guthmiller, and I'm the CEO of Orange City Area Health System, and have a familiar face with me today. I'm Dr. Al Laird. Dr. Laird has the distinction of being the first repeat attendee to the COVID briefing, so congratulations on that.
Thank you, very good.
I want to start out today with our scoreboard. One of the things we present on an annual basis, and on a daily basis. The number of tests performed at Orange City Area Health System as of 6 a.m. this morning is 62. Still remain at 3 positive. The last positive was on April 2nd. Negative tests are 56. And we currently have 3 tests pending. So we'll continue to provide updates on that as the testing goes along. Speaking of testing, that's the theme for today. And we're going to talk through some of the details of that with Dr. Laird. There's been some discussion recently, some questions in our community about whether there are potential positives in our community that weren't tested because they didn't meet the criteria. We don't track that number. The people who presented with maybe a symptom or two or not enough symptoms, certainly, to be tested, we're not tracking that number. But it could easily be, and in fact, likely that the number of positives in our community is higher than the 3 that we have documented. If this in fact is the case, I think Dr. Laird will indicate that that's good news in a way, because we're developing an immunity to it. That immunity is building within our community. And it's good news also because we are not seeing severe disease from the COVID-19. So if there are positives in our community that have not been tested, we are not seeing severe disease, and that's a good thing. So we're trying to be reasonable in our approach. We're not letting our guard down. We'll talk a little bit more about that in just a second. But Dr. Laird, could you talk a little bit about those folks that aren't being tested, or even the screening protocols that we're following?
Absolutely. We continue to follow the Iowa Department of Health guidelines. And what those look for are people who either are going to be at risk of having severe disease, people who have a high likelihood to spread it to multiple other people, such as those living in a communal situation like a nursing home or a group home or something like that. Those who are who are 65 or over with significant other diseases, or those who are going to be hospitalized and have typical diseases or typical comorbidities and typical symptoms. So those are the guidelines we continue to follow, and there's multiple reasons for that. First of all is, while yes, tests are becoming more abundant, there still isn't a large supply of them, and places like Sioux Falls have a need. I think we've all seen with the news. Sioux City, Worthington, other places that we're seeing more activity have a need. And so we also want to continue to be judicious in those and not use them where they will not help us. And then also what we're looking for are those people who have a high likelihood of needing significant health resources, those who are going to wind up in the hospital, those who may end up in the ICU or even a ventilator. So we're trying to target those folks. So there are times when people come in with symptoms that are consistent with COVID, and we may say, well, at this time you don't qualify for testing. If you become more ill, that doesn't mean we wouldn't test you in the future. But if you have a milder case, and to some extent, hopefully you do, and your case remains mild, build your immunity, go home, self-isolate, and I won't go into all those details again, but those are readily available at the Iowa Department of Health as to what you need to do with self-isolating. Act as though you have the disease, and hopefully you do, and you build your immunity, and you never get more than a mild case, even though no one wants to be sick. At least it's not severe enough to wind you up in the hospital.
So just to repeat something that you indicated, because of the outbreaks in the Sioux Falls, Worthington areas, and to some extent maybe even Sioux City, those testing resources are being allocated to those communities. So what we have here is adequate supply for what we need based on the symptoms of our patients and the needs. And again, if we are having positives in our community, they're mild. Yes. In terms of the outcome, and that's good because then we're building immunities to that. I mentioned that we're not letting our guard down, and we're certainly not. You know, we've been talking about some pretty good numbers over the last several editions of the daily briefing here. But that I think the message that you received or should have received in all of these is continue to be vigilant in your social distancing measures. One of the things, and again, we're trying to be reasonable in our approach. One of the reasonable things that we think is prudent at this point is that beginning on Thursday of this week, 6 a.m. Thursday morning, all patients and visitors will be masked coming into our facility. That is not because we're fearful of something or that we're experiencing higher rates of infection. It is simply a response to the fact that there is more positivity around in our area. The Smithfields, the JBS in Worthington, Sioux City, et cetera. It's more around us, but it's not necessarily here. So we think that it's a prudent step beginning this Thursday to mask everybody coming into our facility. To date, we've had about 1,000 cloth masks made and donated to us. And so for that, we're very grateful. Thank you very much. We appreciate that. I know I have one with pheasants on it. And so that's a particularly good one for me. I appreciate that. We continue to accept donations on those masks also. So if those of you listening to this message would like to or are wondering whether we will accept masks, absolutely. We will do that. It helps us preserve the other PPE, the other masks for cases that we have for patients, medical things going on. We hope to be needing those more, not for COVID-19 stuff, but for surgical stuff. And like we talked about yesterday, we do intend to proceed as quickly as we can, again, somewhat subject to Governor Reynolds' proclamation that will currently is through April 30th. So we'll stay very much in tune with that. We'll like to save our surgical masks for those situations, but please continue to do cloth masks and donate them if you would like. We're going to make those available to patients as they come in. And if you have a need for that mask, you may keep it, or you may drop it in a bin that we'll have, and we'll wash it and get it ready for future use. I want to shift a little bit to another topic that's been out there and more prevalent lately, and that is the antibody testing. And I know I had some misconceptions of what the test was, what it meant, and that if you're positive, you're bulletproof, and things like that. So could you talk a little bit about the antibody testing?
I would be pleased to. And I need to talk a little bit about what testing we do today so we can distinguish these two different types of tests. So the test we do today is actually a test where we're detecting the virus. We're taking a swab sampling from the person, and then that's amplified to see if we find the virus present. That's the kind of testing we can do today. That's the kind of testing that we've been doing all along.
Those are the 62 tests that we have documented.
Thank you. That is exactly right. What we're hoping to begin doing in the near future, and is being done in some places, is to test blood to see if you have had the virus or if you currently have the virus. So there's two different types of proteins we look at that give us immunity. One is a short-term immunity called IgM, and that test is not yet available, but there's many labs working on it. The other test is called an IgG, and that looks to see if you've had the virus and hopefully are beginning to clear it from your system. And it would tell us if indeed you've been exposed to, and here my verbiage is very cautiously chosen, a coronavirus. Many of these tests have been developed very rapidly, and we appreciate the response of industry and the government and everybody who's worked together to get us these tests. However, because they have been rapidly developed and rapidly deployed, They have not undergone the testing that would normally happen before a test is brought to market and to be used in the public. So there's some things we don't know about these tests. One of those things is how specific they are. So we know if we get a test and it shows that you have IgG, that protein that indicates you've had the illness, that your body's fighting it, and that you're probably not infective anymore, and that you may have immunity against it. That test, we know will tell us about a coronavirus, but is it the coronavirus? So is it this new coronavirus that is out and causing the problems that it is? Or is it one of the other 4 or 5 that we know we have that circulate from time to time in our community and in other communities, and that you've actually had one of those coronaviruses that cause mild illness? That is the difficulty. So we may be able to say, oh, look, you have immunity, but I don't know that I can tell you 100% it's that virus, and therefore you're bulletproof, or that we're building immunity in our community to that specific coronavirus. And so it's a gray area, which we often deal with in medicine. We would love if it was always black and white. It often isn't. But if we did see a number of those tests starting to come back positive when we're able to do them, that would be encouraging.
Yeah, so it's positive, but it's kind of what it's worth.
That's exactly right.
Also, so again, you don't necessarily always hear that on the nightly news kinds of things, and so and that's where my misconception was, where when you get this IgG, you're immune and go live your life.
Yes.
Go do surgeries, go to the grocery store, go check out people, wherever.
Yes.
And that's been touted as one of these things that is going to open up America again. Well, it may, and it may help, but it is not perfect.
It's not perfect, and that's exactly right. It certainly will help us and guide us if we happen to do a lot of testing and don't see that protein, that IgG. Then we can say, well, there's not a lot of immunity to coronavirus in our community. Or if we see a lot of it, we can say, well, there is immunity, and we believe it's against one that we're currently seeing right now, but we cannot absolutely say that with certainty. So I think that's a distinction that hasn't been in the news very well, and therefore it's part of the solution, but not the complete solution.
And that IgG test would be a test that we perform locally.
That is our goal. They are rolling it out in many areas. We are working hard to get that, to be able to get it up and running. Again, because this is new, those things are going to go to hotspots and areas that have a huge need before they're going to look at us. And so there'll be limited supply, and we won't be able to test just anybody that comes in or anybody that wants it. We'll have to be judicious again so that we don't burn through all of our tests and then not have any should things start to go badly here. So again, we still have to continue to plan for the future, but use what we need at the proper time.
Well, thank you so much for joining us today. We really appreciate it. And thank you for joining us at home as well. We appreciate the support that you've given to all of us here at Orange City Area Health System, and we greatly appreciate that. So I'm just going to close today again by saying stay vigilant, stay strong, stay healthy. Thank you again for joining us.
Thank you.